Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Fragile X syndrome. Introduction. Fragile X syndrome is the most common form of inherited intellectual disability. A problem with a specific gene causes the disease. People with only a small change in the gene might not show any signs of Fragile X. People with bigger changes can have severe symptoms. Getting treatment early for Fragile X can help. This program explains what Fragile X syndrome is and what causes it. It also covers how Fragile X is diagnosed and the available treatment options. What is Fragile X syndrome? Fragile X syndrome is the most common form of inherited intellectual and developmental disability. Fragile X happens when there is a change or mutation in a single gene called the FMR1 gene. The FMR1 gene normally makes a protein the body needs for the brain to develop. But when there is a change in this gene, the body makes only a little bit or none of the protein. This can cause the symptoms of Fragile X. Fragile X is inherited, which means it is passed down from parents to children. Parents can have children with Fragile X even if the parents do not have Fragile X themselves. The changes in the gene can become more serious when passed from parent to child. Some people may only have a small change in their FMR1 gene, called a permutation. These people may not show any signs of Fragile X. Other people may have bigger changes in the gene, called a full mutation, that cause the symptoms of Fragile X syndrome. Fragile X syndrome can affect both males and females. However, females often have milder symptoms than males. This is because females have 2 X chromosomes while boys have 1 X and 1 Y chromosome. A single Fragile X is likely to affect them more severely. Symptoms. Not everyone with Fragile X has the same signs and symptoms, but they do have some things in common. This section explains some common signs of Fragile X. Many people with Fragile X have intellectual disabilities. These problems can range from mild learning disabilities to more severe intellectual and developmental disabilities. Most children with Fragile X have some behavioral challenges. They may be afraid or anxious in new situations. Many children, especially boys, have trouble paying attention or may be aggressive. Girls may be shy around new people. Most boys with Fragile X have some problems with speech and language. They may have trouble speaking clearly. They may stutter or leave out parts of their words. Boys may also have problems understanding clues when talking to other people, such as understanding the speaker's tone of voice or body language. Girls usually do not have severe problems with speech or language. Many children with Fragile X are bothered by certain sensations, such as bright light, loud noises, or the way something feels. Some do not like to be touched. They may have trouble making eye contact with other people. Teens and adults with Fragile X may have long ears, faces, and jaws. Many people with Fragile X may also have loose, flexible joints. They may have flat feet and be able to extend joints like the thumb, knee, and elbow further than normal. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Each cell in the human body contains thousands of genes. Genes tell the body to make certain substances. Our genes make us look the way we do. They also have a lot to do with our health. Fragile X syndrome is caused by a change in the FMR1 gene. The FMR1 gene makes a protein that is needed for normal brain development. Genes are found on chromosomes. Every non-reproductive human cell contains 23 pairs of chromosomes. People get their chromosomes from their parents. People get one of each pair of chromosomes from their mother and one of each pair from their father. The chromosomes that form the 23rd pair are called the sex chromosomes. They decide if a person is male or female. Females have 2 X chromosomes, or XX. Males have 1 X and 1 Y chromosome, or XY. The FMR1 gene is on the X chromosome. The chromosomes and genes have a special code called DNA. DNA has 4 chemical letters called bases, A, C, T, and G. The order of the letters determines the information carried in each gene, like the way that a specific pattern of letters makes up the words in a sentence. There is a place in the FMR1 gene where the DNA pattern CGG is repeated over and over again. In most people, the number of repeats is small, which is normal. If the number of repeats is too large, the gene turns off. This is called a trinucleotide repeat disorder. People inherit the disorder from their parents. When the gene is turned off, no protein is made. Without the protein, the person develops Fragile X syndrome. Diagnosis. Fragile X syndrome is not usually diagnosed until a child is school age. The first clue in children often is a delay in reaching 1 or more developmental milestones. Developmental milestones are things most children can do by a certain age. For example, most children can walk without help by 15 months of age. Fragile X syndrome can be diagnosed with a blood test. Testing can show changes in the FMR1 gene. Prenatal testing can identify the gene that causes Fragile X before birth. A diagnosis of Fragile X syndrome can be helpful to the family because it can provide a reason for a child's intellectual disabilities and behavior problems. This allows the family and other caregivers to learn more about the disorder and manage care so that the child can reach his or her full potential. Anyone who is thinking about Fragile X syndrome testing should consider having genetic counseling prior to getting tested. The genetic counselor determines whether a condition in the family may be genetic and estimates the chances that another relative may be affected. Genetic counselors offer and interpret genetic tests that may help to estimate risk of disease. The genetic counselor also provides psychological counseling to help families adapt to their condition or risk. Treatment. There is no cure for Fragile X syndrome. However, there are a variety of ways to help minimize the symptoms of the condition. The symptoms of Fragile X syndrome are most often treated using a combination of the following: special education, behavioral and physical therapy, medication. Children with Fragile X who receive appropriate education, therapy, and medication have the best chance of using their individual capabilities and skills. Even those with significant intellectual disability can learn to master many self-help skills. The sooner a child begins to get help, the more opportunity there is for learning. Because a young child's brain is still forming, early intervention gives children the best start possible. Some forms of assistance, like speech therapy, for example, are available even before a formal diagnosis is made. Speech-language therapists can help Fragile X patients that have speech problems. The therapists work on improving pronunciation of words and sentences, slowing down speech, and using language more effectively. They may set up social or problem-solving situations to help a child practice using language in meaningful ways. Rarely, some children with Fragile X syndrome may not be able to speak well enough to communicate with others. For these children, nonverbal ways of communication may be taught. Occupational therapists help find ways to adjust tasks to match a person's needs and abilities. For example, this type of therapist might help a teenager with Fragile X identify a job, career, or skill that matches his or her interests and individual capabilities. Physical therapists design activities and exercises to build motor control and to improve posture and balance. They can teach parents ways to exercise their baby's muscles. At school, they may help a child who is easily overstimulated or who avoids body contact participate in sports and games with other children. Behavioral therapists try to identify situations in which a child acts in a negative way and then seeks ways to prevent or cope with these stressful occasions. These therapists also work with parents and teachers to find useful responses to desirable and undesirable behavior. Currently, there is no medication that can cure Fragile X. No drugs have been approved specifically for the treatment of Fragile X or its causes. But in many cases, medications have been used to treat the symptoms of Fragile X. Medications may be used to treat aggression, attention problems, mood changes, seizures, sensory overstimulation, sleep disturbances, other symptoms. Even if treatment for Fragile X doesn't begin until late childhood or adulthood, it is never too late to benefit from treatment.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Fragile X syndrome is the most common form of inherited intellectual disability. A problem with the FMR1 gene causes the disease. When there is a change in this gene, the body makes only a little bit or none of a certain protein, which can cause the symptoms of Fragile X. Fragile X syndrome affects both males and females. However, females often have milder symptoms than males. This is because females have 2 X chromosomes while boys have 1 X and 1 Y chromosome. A single Fragile X is likely to affect them more severely. Many people with Fragile X have intellectual disabilities. These problems can range from mild learning disabilities to more severe intellectual and developmental disabilities. Most children with Fragile X have some behavioral challenges. They may be afraid or anxious in new situations. Fragile X syndrome is not usually diagnosed until a child is school age. The first clue in children often is a delay in reaching 1 or more developmental milestones. Fragile X syndrome can be diagnosed with a blood test. There is no cure for Fragile X syndrome. However, there are a variety of ways to help minimize the symptoms of the condition. The symptoms of Fragile X syndrome are most often treated using a combination of the following: special education, behavioral and physical therapy, medication. Thank you for using Explain.